Question 1. A patient presents with a diagnosis of acute pancreatitis. The physician documents that the patient has a history of gallstones and has been experiencing severe abdominal pain and vomiting. Which of the following 10 centimeter codes should be used to report this diagnosis? AK.0. Calculus of gallbladder with acute cholecystitis without mention of obstruction. BK.90. Acute pancreatitis unspecified. CK.10. Calculus of gallbladder with acute cholecystitis with obstruction. DK.0. Acute pancreatitis unspecified. Answer: BK.90. Acute pancreatitis unspecified. Explanation: in this case, the key diagnosis is acute pancreatitis, which is best represented by 10 centimeter code K.90, as there is no indication that the pancreatitis is linked to a specific cause, e.g. alcohol use or gallstones. The code for acute pancreatitis is not specified with any further description, so unspecified is appropriate in this context. While the patient has a history of gallstones, this does not change the fact that the acute condition being diagnosed is pancreatitis, not a gallbladder-related condition. Options A, C, and D are incorrect because they focus on gallbladder issues, cholecystitis and gallstones, which are not the primary concern in this scenario. Question 2. Mr. Thompson is a 55-year-old patient who has been diagnosed with type 2 diabetes mellitus and hypertension. He is prescribed medication for both conditions, and his physician documents both diseases in his chart. According to 10 centimeter coding conventions, which of the following is the most accurate way to code this diagnosis? A. 0.9. Type 2 diabetes mellitus without complications. Essential hypertension. B. 0.65. Type 2 diabetes mellitus with hypoglycemia. Essential hypertension. C. 0.9. Type 2 diabetes mellitus without complications. 0.9. Hypertensive heart disease without heart failure. D. 0.9. Type 2 diabetes mellitus without complications. 0.1. Secondary hypertension due to endocrine disorder. Answer A. 0.9. Type 2 diabetes mellitus without complications. Essential hypertension. Explanation: in this case, the most appropriate 10 centimeter codes are 0.9 for type 2 diabetes mellitus without complications and were essential hypertension. According to the ICD coding guidelines, the code 0.9 is used for type 2 diabetes when no complications are documented. Since there are specific complications mentioned in the documentation, such as diabetic nephropathy or neuropathy, this code is correct. Option B is incorrect because the patient's chart does not mention hypoglycemia, so 0.65 would not apply. Option C is incorrect because the patient does not have hypertensive heart disease. 0.9. Option D is incorrect because secondary hypertension is only used when hypertension is caused by another medical condition, which is not the case here. Question 3. Scenario: Mrs. Johnson, a 45-year-old woman, has been diagnosed with a chronic respiratory disease and requires long-term oxygen therapy. The physician documents that she has a history of chronic obstructive pulmonary disease, COPD, with emphysema, and she is receiving oxygen therapy for respiratory insufficiency. Based on the 10 centimeter coding conventions, which codes should be assigned? A. J.9. Chronic obstructive pulmonary disease unspecified to 0.81. Dependence on oxygen therapy. B. J.9. Emphysema unspecified to 0.81. Dependence on oxygen therapy. C. J.0. Chronic obstructive pulmonary disease with acute lower respiratory infection to 0.81. Dependence on oxygen therapy. D. J.9. Chronic obstructive pulmonary specified. J.0. Emphysema centrilobular. Answer A. J.9. Chronic obstructive pulmonary disease unspecified to 0.81. Dependence on oxygen therapy. Explanation: in this case, the primary diagnosis is COPD, which should be coded with J.94. Chronic obstructive pulmonary disease unspecified. There is no specific mention of the subtype of emphysema, G. centrilobular, so it is more appropriate to use the unspecified code for COP. Secondary diagnosis code should be 0.81 to indicate dependence on oxygen therapy, as documented by the physician. Option B is incorrect because J.9 for unspecified emphysema is not the best choice when the patient is specifically diagnosed with COPD and the use of a COPD code J.9 is more accurate. Option C is incorrect because the documentation does not mention any acute respiratory infection, which would require the J.0 code. Option D is incorrect because combining J.9 and J.0 is redundant, as COPD is already addressed with the J code. Question 4. A patient is diagnosed with acute myelocytic leukemia or ML and presents with severe bleeding complications. The physician also documents that the patient has been receiving chemotherapy. The patient is not yet in remission, and the physician specifies that the leukemia is in an acute phase. How should the coding for this scenario be handled according to ICD 10 cm coding guidelines? C.0 acute myelocytic leukemia not having achieved remission. D.8 anemia and other chronic diseases. B.C.0 acute myelocytic leukemia not having achieved remission. T.1 adverse effective chemotherapy initial encounter. C.10 acute myelocytic leukemia remission. T.1 adverse effective chemotherapy initial encounter. D.C.0 acute myelocytic leukemia not having achieved remission. D.9 anemia unspecified. Answer B.C.0 acute myelocytic leukemia not having achieved remission. T.1 adverse effective chemotherapy initial encounter. Explanation: the primary diagnosis in this case is acute myelocytic leukemia, AMER, coded as C.04. Acute myelocytic leukemia not having achieved remission, of which accurately reflects the patient's current status. The physician also documents chemotherapy treatment and adverse effects, so the secondary diagnosis should be T.1 for adverse effective chemotherapy initial encounter. The specific coding conventions for chemotherapy and its adverse effects are clear, and the patient's condition is not yet in remission. Option A is incorrect because the secondary diagnosis D.8 refers to anemia in chronic diseases but does not reflect the chemotherapy treatment. Option C is incorrect because the patient is not in remission, so C.10 would be an incorrect choice. Option D is incorrect because D.9 is used for unspecified anemia not related to chemotherapy. Question 5. Mr. Lee, a 60-year-old male, has a documented diagnosis of hypertension and coronary artery disease CAD. His physician also notes that Mr. Lee recently had a myocardial infarction, heart attack which he has now recovered from, and he is undergoing a rehabilitation program. How should these diagnoses be accurately coded according to ICD 10 cm guidelines? A.10 atherosclerotic heart disease of native coronary artery, essential hypertension, Roy 9. Acute myocardial infarction unspecified. E09 110 atherosclerotic heart disease of the native coronary artery with unstable angina. Essential hypertension. C09 9 coronary artery disease unspecified. Essential hypertension. Roy 9 subsequent myocardial infarction unspecified. D.10 atherosclerotic heart disease of native coronary artery. Essential hypertension. Roy 9 acute myocardial infarction unspecified. So 0.9 rehabilitation care unspecified. Answer D and 10 atherosclerotic heart disease of native coronary artery. Essential hypertension. 9 acute myocardial infarction unspecified. 0.9 rehabilitation care unspecified. Explanation: in this scenario, the primary diagnosis of coronary artery disease CAD should be coded as Roy 10, which represents atherosclerotic heart disease of the native coronary artery. The hypertension is coded as a 4. Essential hypertension, since the patient recently had a myocardial infarction, but it has been documented as a previous event that is now resolved. The proper code is a .94. Acute myocardial infarction unspecified because it refers to the incident as a past occurrence without any further specificity. The patient is under rehabilitation care, says 0.94. Rehabilitation care unspecified should also be included as a secondary code. Option A is incorrect because M.9 should not be used for a resolved myocardial infarction. It refers to the acute episode. Option B is incorrect because M.110 refers to unstable angina, which is not documented in the scenario. Option C is incorrect because R.9 is used for subsequent myocardial infarctions, but this is not a subsequent event. Question 6. A physician documents that a 28-year-old female patient presents with a suspected diagnosis of endometriosis. The patient has been experiencing pelvic pain, heavy menstrual bleeding, and infertility. The physician has ordered a laparoscopy for confirmation of the diagnosis, which a 10-centimeter code should be used for this condition. AN.0. Endometriosis of the uterus. BN.9. Endometriosis unspecified. A C in .4. Endometriosis of the ovary. D in .8. Other endometriosis. Answer B in .9. Endometriosis unspecified. Explanation. The most appropriate 10-centimeter code in this case is N.9, which is used when endometriosis is suspected but not yet confirmed. The physician has ordered a laparoscopy for confirmation, and without a confirmed diagnosis, the unspecified endometriosis is the correct choice. Since the physician has not specifically noted the location of the endometriosis, e.g. uterus ovary, the most accurate code, option A, is incorrect because the uterus is not specified as the location of the endometriosis. Option C is incorrect because the ovary is not specified as the location of the endometriosis. Option D is incorrect because the patient does not have a documented diagnosis of other endometriosis. Question 7. A 40-year-old male patient is diagnosed with chronic renal failure due to hypertension. He has also been experiencing significant fluid retention, and his physician has recommended dialysis. How should this case be coded according to ICD 10-centimeter guidelines? A.9. Hypertensive heart and chronic kidney disease stage 1 N.9. Chronic kidney disease unspecified. B.0. Hypertensive heart and chronic kidney disease stage 1 N.3. Chronic kidney disease stage 3 C. Essential hypertension N.9. Chronic kidney disease unspecified. D.9. Hypertensive heart and chronic kidney disease stage 1.5. Chronic kidney disease stage 5. Answer B.0. Hypertensive heart and chronic kidney disease stage 1 N.3. Chronic kidney disease stage 3. Explanation. In this scenario, the patient has chronic kidney disease CKD secondary to hypertension, so the appropriate codes are on 0. Hypertensive heart and chronic kidney disease stage 1 and N.3. Chronic kidney disease stage 3. The physician's document indicates fluid retention, which is indicative of more advanced kidney dysfunction. This makes stage 3 CKD the most appropriate diagnosis. Stage 1 CKD reflects the underlying condition of hypertension and the impact on kidney function. Option A is incorrect because the chronic kidney disease stage is incorrectly identified as stage 1. Option C is incorrect because the combination of hypertension and CKD in stage 3 should be used, not unspecified CKD. Option D is incorrect because stage 5 CAD in .5 represents end-stage renal failure, which is not yet documented in this case. Question 8. Mr. Davis, a 35-year-old male patient, presents to the clinic with shortness of breath, fever, and a dry cough. The physician orders a chest X-ray, which reveals bilateral pneumonia. He is diagnosed with bacterial pneumonia and is started on antibiotics. According to ICD 10-centimeter guidelines, how should this condition be coded? AJA.9. Pneumonia, unspecified organism. Cough. BJ.1. Pneumonia due to Streptococcus pneumoniae. R.81. Shortness of breath. CJ.9. Pneumonia, unspecified organism. DJ.9. Bacterial pneumonia, unspecified. Cough. Answer CJ.9. Pneumonia, unspecified organism. Explanation. The patient's symptoms, shortness of breath, fever, dry cough, and chest X-ray findings point to pneumonia, but the physician has not specified the organism causing the infection. Therefore, the appropriate code is J.94. Pneumonia, unspecified organism. Since the cause of pneumonia has not been identified as a specific bacterial organism, Streptococcus pneumoniae, the unspecified code should be used. Option A is incorrect because the physician did not document the specific organism causing the pneumonia. Option B is incorrect because the organism, Streptococcus pneumoniae, is not documented. Option D is incorrect because the code J.9 is more specific to bacterial pneumonia, but the organism is not identified here. Question 9. A 42-year-old male patient presents to his primary care physician with complaints of abdominal pain, bloating, and diarrhea. After examination, the physician diagnoses him with irritable bowel syndrome (IBS). The patient also has a history of gastroesophageal reflux disease (GERD). How should these conditions be coded? A. K.9. Irritable bowel syndrome unspecified. K.9. Gastroesophageal reflux disease unspecified. B. K.0. Irritable bowel syndrome with diarrhea. K.9. Gastroesophageal reflux disease unspecified. C. K.9. Irritable bowel syndrome unspecified. K.9. Esophagitis unspecified. D. K.0. Irritable bowel syndrome with diarrhea. K.0. Gastroesophageal reflux disease with esophagitis. Answer A. K.9. Irritable bowel syndrome unspecified. K.9. Gastroesophageal reflux disease unspecified. Explanation: irritable bowel syndrome is coded as K.9 when it is unspecified. This code captures the general diagnosis of IBS without specifying the subtype, G with diarrhea, constipation, or mixed. The gastroesophageal reflux disease GERD is coded as K.9, which is used when the disease is specified as being associated with esophagitis or another specific complication. Option B is incorrect because K.0 refers to IBS with diarrhea specifically, but no subtype is documented in this case. Option C is incorrect because K.9 refers to esophagitis, which is not diagnosed in this patient. Option D is incorrect because K.0 refers to GERD with esophagitis, which is not present in this case. Question 10. A 70-year-old female patient presents with acute lower abdominal pain, nausea, and fever. After examination, the physician diagnoses the patient with acute appendicitis and documents that it is complicated by a perforation. The patient is scheduled for surgery. How should the coding be handled according to ICD 10 cm guidelines? A. K.80. Acute appendicitis with other complications. K.2. Acute appendicitis with perforation. B. K.2. Acute appendicitis with perforation. C. K.9. Acute appendicitis unspecified. K.2. Acute appendicitis with perforation. D. K.1. Acute appendicitis with gangrene. K.2. Acute appendicitis with perforation. Answer B. K.2. Acute appendicitis with perforation. Explanation: the correct diagnosis code for acute appendicitis complicated by perforation is K.2. Acute appendicitis with perforation. This accurately reflects the diagnosis as documented by the physician. When appendicitis is complicated by perforation, the perforation is specifically mentioned in the code, so additional codes are not needed for the like gangrene or other unspecified complications. Option A is incorrect because K.80 is for appendicitis with other complications but does not specify perforation. Option C is incorrect because K.9 is used for unspecified acute appendicitis, but the physician has documented perforation, so K.2 is the correct choice. Option D is incorrect because the physician did not document gangrene, so K.1 would not apply. Question 11. A 60-year-old male with a history of smoking presents with a chronic cough, weight loss, and hemoptysis, coughing up blood. Imaging reveals a mass in the left lung, which is suspected to be lung cancer. The physician has ordered a biopsy. The physician also documents a history of tobacco use disorder. How should the diagnosis be coded in ICD 10 cm? A. C.90. Malignant neoplasm of lung. Unspecified. So 0.890 on. Personal history of nicotine dependence. But C.1. Malignant neoplasm of left lung. 0.890 on. Personal history of nicotine dependence. C.9. Malignant neoplasm of lung. Unspecified of 0.210. Nicotine dependence. Cigarettes uncomplicated. D.C.90. Malignant neoplasm of lung. Unspecified F.210. Nicotine dependence. Cigarettes uncomplicated. Answer C.9. Malignant neoplasm of lung. Unspecified of F.210. Nicotine dependence. Cigarettes uncomplicated. Explanation: the diagnosis for the suspected lung cancer is coded as C.9, which stands for malignant neoplasm of lung. Unspecified, as the type of lung cancer has not yet been confirmed with a biopsy. The patient's history of tobacco use is coded as F.210. Nicotine dependence. Cigarettes uncomplicated. Since the physician has documented tobacco use disorder and it is uncomplicated, option A is incorrect because the code C.90 is for Malignant neoplasm of lung, unspecified, but Z.891 for personal history of nicotine dependence is not relevant in this context since the patient is still actively using tobacco. Option B is incorrect because it refers to a specific location, left lung, but the exact site of the malignancy hasn't been confirmed yet. Option D is incorrect because while the codes are correct, Z.90 should not be used as it is an unspecified code and doesn't reflect the physician's suspicion of lung cancer that is actively being investigated. Question 12. A 50-year-old male patient presents with dizziness and a headache. After examination and diagnostic tests, the physician diagnoses benign paroxysmal positional vertigo (EPP) and prescribes medication for symptom relief. The patient also has a history of chronic sinusitis. How should the conditions be coded? AH.10. Benign paroxysmal vertigo, right ear, GA.9. Chronic sinusitis unspecified, BH.1. Benign paroxysmal vertigo unspecified ear, JA.9. Chronic sinusitis unspecified, CH.10. Benign paroxysmal vertigo, right ear, GA.9. Chronic rhinitis unspecified, DH.9. Benign paroxysmal vertigo unspecified it. 0. Chronic maxillary sinusitis. Answer BH.1. Benign paroxysmal vertigo unspecified it. J.9. Chronic sinusitis unspecified. Explanation: the correct code for benign paroxysmal positional vertigo BPE ESH.1, which is used for benign paroxysmal vertigo unspecified ear. As the physician did not specify which ear is affected, chronic sinusitis is coded as J.9, which represents a chronic sinu. Specified, as the physician did not provide further specifics regarding the type of sinusitis, e.g., maxillary or frontal. Option A is incorrect because the ear affected is not specified as the right ear, so H.10 would not apply. Option C is incorrect because chronic rhinitis J.9 is not the correct code for chronic sinusitis. Option D is incorrect because the ear is not specified, so H.9 would not be correct and the sinusitis is not specified as maxillary. Question 13. A 45-year-old male patient is admitted for chest pain. The physician diagnoses the patient with a non-elevation myocardial infarction and STEMI. The patient has a history of hyperlipidemia, which is being managed with medication. How should this case be coded? A.9. Acute myocardial infarction unspecified E.5. Hyperlipidemia unspecified. B.4. Non-elevation myocardial infarction E.5. Hyperlipidemia unspecified. 10. Non-elevation myocardial infarction E.1. Pure hypercholesterolemia D.4. Non-elevation myocardial infarction E.1. Pure hypercholesterolemia. Answer B.4. Non-elevation myocardial infarction E.5. Hyperlipidemia unspecified. Explanation: the patient's chest pain is diagnosed as non-elevation myocardial infarction and STEMI, which is coded as R.4. This is consistent with the documentation provided. Hyperlipidemia is documented as history of hyperlipidemia, and the correct code for unspecified hyperlipidemia is E.5. Since there is no mention of specific lipid disorder such as hypercholesterolemia, this is the most accurate code. Option A is incorrect because the myocardial infarction is specifically diagnosed as NSTEMI 0.4, not unspecified 0.9. Option C is incorrect because the specific type of hyperlipidemia is not documented, so 0.1, pure hypercholesterolemia, is not applicable. Option D is incorrect because the patient's hyperlipidemia is not specified as hypercholesterolemia. Question 14. A 72-year-old female patient with a history of rheumatoid arthritis presents with pain, swelling, and stiffness in her hands and wrists. Upon examination, the physician diagnoses the patient with acute exacerbation of rheumatoid arthritis. The physician also notes that the patient has osteoarthritis of her knees and hips. How should these conditions be coded? AM.9. Rheumatoid arthritis unspecified. MM.9. Osteoarthritis unspecified. MM.79. Rheumatoid arthritis with other specified complications. M.9. Osteoarthritis unspecified. C. MM.9. Rheumatoid arthritis unspecified. MM.9. Osteoarthritis of knee unspecified. D. MM.9. Rheumatoid arthritis unspecified. M.9. Osteoarthritis of hip unspecified. Answer A, MM.9. Rheumatoid arthritis unspecified, MM.9. Osteoarthritis unspecified. Explanation: rheumatoid arthritis exacerbated in this case is coded as M.9, which stands for rheumatoid arthritis unspecified. Since the physician has documented both osteoarthritis of the knees and hips, the appropriate code for osteoarthritis is M.9, which refers to osteoarthritis unspecified. But the code for osteoarthritis does not specify the joints involved, knee, hip, so the general osteoarthritis code is used in this case. Option B is incorrect because rheumatoid arthritis with other specified complications. Mem.79 is not applicable as no specific complications beyond exacerbation are documented. Option C is incorrect because the diagnosis does not focus solely on osteoarthritis of the knee. Option D is incorrect for similar reasons as option C, since osteoarthritis of the hip is not the main diagnosis. Question 15. A 30-year-old male patient presents to the emergency department with severe abdominal pain, vomiting, and fever. After diagnostic imaging, the physician diagnoses acute pancreatitis. The patient has a history of gallstones, which the physician notes may have contributed to the pancreatitis. How should this condition be coded? A K.9, acute pancreatitis unspecified, K.9. Gallstones unspecified, B K.0, acute pancreatitis alcoholic, K.9. Gallstones unspecified, C K.1, acute pancreatitis due to gallstones, K.9. Gallstones unspecified, D K.9, acute pancreatitis unspecified, K.0. Calculus of gallbladder with acute cystitis. Answer C K.1, acute pancreatitis due to gallstones, K.9. Gallstones unspecified. Explanation: the acute pancreatitis is attributed to gallstones, so the code for acute pancreatitis due to gallstones, K.1, is used. Additionally, the patient's history of gallstones is coded with K.94. Gallstones unspecified as the specific details of the gallstones, e.g. size, type, mentioned in the documentation. Option A is incorrect because the pancreatitis is specified as being due to gallstones, not unspecified. Option B is incorrect because there is no mention of alcohol use in the medical record to support the code for alcoholic pancreatitis. Option D is incorrect because the physician did not diagnose acute cholecystitis inflammation of the gallbladder, and the gallstone code should reflect the general gallstones diagnosis, K.9. Question 16. A 45-year-old female patient with a long history of hypertension presents for a routine checkup. Her blood pressure is elevated, and the physician diagnoses her with stage 1 hypertension. The physician also notes a family history of heart disease. How should this case be coded? A. Essential hypertension, Z.49. Family history of other ischemic heart disease. B. Essential hypertension, Z.9. Family history of other specified diseases. C. 0.9. Hypertensive heart disease without heart failure, Z.49. Family history of other ischemic heart disease, D.O. at 0.9. Hypertensive heart disease without heart failure, Z.9. Family history other specified diseases. Answer A. Essential hypertension, Z.49. Family history of other ischemic heart disease. Explanation: the patient's hypertension is diagnosed as stage 1 hypertension and should be coded as essential hypertension, which applies to individuals with hypertension without documented organ damage. The physician has noted a family history of heart disease, specifically ischemic heart disease, so Z.49 is used. Reflect this family history. Option B is incorrect because Z.9 is a more general code for family history of unspecified diseases which does not specify ischemic heart disease. Option C and option D are both incorrect because hypertensive heart disease 0.9 would not apply in this case since the physician did not document any heart disease related to the hypertension. Question 17. A 40-year-old male patient presents with a skin rash on his face which is identified as rosacea. The patient also has a history of asthma which is well controlled. How should this case be coded? A. LL.9. Rosacea unspecified, J.909. Asthma unspecified uncomplicated, BLL.0. Rosacea erythematotelangiectatic type J.909. Asthma unspecified uncomplicated C. LL.9. Rosacea unspecified J.40. Moderate persistent asthma D. LL.0. Rosacea erythematotelangiectatic type J.40. Moderate persistent asthma. Answer 8. LL.9. Rosacea unspecified J.909. Asthma unspecified uncomplicated. Explanation: Rosacea is diagnosed as unspecified in this case, so L.9 is the correct code. The patient's asthma is well controlled, but the documentation does not provide further details such as the severity or type of asthma, so J.909 asthma unspecified uncomplicated is used. Option B is incorrect because the erythematotelangiectatic type of rosacea is not documented. Option C is incorrect because moderate persistent asthma is not mentioned in the medical record. Option D is incorrect for the same reasons as option C, and the type of rosacea is not confirmed as erythematotelangiectatic. Question 18. A 60-year-old female patient presents with shortness of breath and fatigue. After diagnostic testing, she is diagnosed with congestive heart failure, CHF. The physician documents that this is a new diagnosis and the patient has no other significant medical conditions. How should this condition be coded? A. 9. Congestive heart failure unspecified. B. 1. Left ventricular failure unspecified. C. 9. Congestive heart failure unspecified. 0.79. Personal history of other diseases of the circulatory system. D. 81. Diastolic heart failure. Answer A. 9. Congestive heart failure unspecified. Explanation: the correct code for congestive heart failure when the specific type G left ventricular or diastolic is not documented is a 0.9, which is used for congestive heart failure unspecified. Option B is incorrect because the documentation does not specify left ventricular failure. Option C is incorrect because the 0.79 is used for personal history of diseases, but there is no mention of a history of circulatory system diseases in this case. Option D is incorrect because diastolic heart failure 81 is not specified by the physician. Question 19. A 35-year-old male presents with severe lower back pain after lifting heavy furniture. The physician diagnoses a lumbar sprain. The patient has a history of chronic lower back pain due to muscle strain. How should the diagnosis be coded? AM 0.5. Low back pain at 0.12 years. Strain of lumbar spine. B. 0.9. Dorsalgia unspecified at 0.12 years. Strain of lumbar spine. C. 0.5. Low back pain. 0.8. Other dorsalgia. D. 0.50. Low back pain at 0.12 years. Strain of lumbar spine. Answer D. 0.50. Low back pain at 0.12 years. Strain of lumbar spine. Explanation: the physician diagnosed the patient with a lumbar sprain, which is best represented by the code at 0.12 year strain of lumbar spine. Additionally, the patient's lower back pain is chronic and M.50 low back pain unspecified is used to capture the ongoing pain. Option A is incorrect because MM.5 refers to low back pain without specifying the underlying cause, which is not as specific as M.50 for this case. Option B is incorrect because the general dorsalgia code is not applicable here. Option C is incorrect because MM.8, other dorsalgia, is used when the specific type of back pain is unknown, which does not apply here. Question 20. A 45-year-old female patient presents for a routine follow-up after her mastectomy for breast cancer, which was diagnosed 2 years ago. The physician documents that the cancer is in remission. How should this follow-up be coded? Is it an encounter for follow-up examination after completed treatment for malignant neoplasm? B is an encounter for follow-up examination after treatment for other conditions. C is 0.3. Personal history of malignant neoplasm of breast encounter for follow-up examination. D is 0.3. Personal history of malignant neoplasm of breasts encounter for follow-up examination after treatment for conditions. Answer C is 0.3. Personal history of malignant neoplasm of breasts is encounter for follow-up examination. Explanation: since the patient had breast cancer, the appropriate code for personal history of malignant neoplasm of breast is 0.3. Additionally, Z is used for encounter for follow-up examination after completed treatment for malignant neoplasm. Option A is incorrect because the Z code should be used in combination with the personal history code. Option B is incorrect because Z applies to follow-up after treatment for non-cancer conditions, not malignancies. Option D is incorrect because Z is not appropriate when dealing with a history of cancer. Question 21. A 60-year-old male patient presents with shortness of breath, a productive cough, and a fever. The physician diagnoses acute bronchitis and notes that the patient has a history of smoking. How should this case be coded? A J.9 acute bronchitis unspecified of F.210 and nicotine dependence cigarettes. B J.9 acute bronchitis unspecified as E.0 tobacco use current. C J.9 chronic obstructive pulmonary disease unspecified at F.210 and nicotine dependence cigarettes. DJ.0 acute bronchitis due to Streptococcus pneumoniae. E.0 tobacco use current. Answer A J.9 acute bronchitis unspecified at F.210 nicotine dependence cigarettes. Explanation: the acute bronchitis is diagnosed as unspecified J.9. The patient has a history of smoking, which is coded using F.210 for nicotine dependence cigarettes, as this reflects the patient's smoking history. Option B is incorrect because tobacco use current .0 is used for individuals who are actively using tobacco, but the specific dependence diagnosis is more appropriate. Option C is incorrect because chronic obstructive pulmonary disease COPD is not documented here. Option D is incorrect because the infection causing bronchitis is not specified as being due to Streptococcus pneumoniae. Question 22. A 45-year-old female presents with symptoms of fatigue, weight loss, and excessive thirst. Laboratory tests reveal elevated blood glucose levels, and the physician diagnoses her with type 2 diabetes mellitus. The physician also documents hypertension and dyslipidemia. How should these conditions be coded? A. 0.9. Type 2 diabetes mellitus unspecified. Essential hypertension. 0.5. Hyperlipidemia unspecified. B. 0.9. Type 2 diabetes mellitus unspecified. Or 0.9. Hypertensive heart disease without heart failure. 0.5. Hyperlipidemia unspecified. C. 0.65. Type 2 diabetes mellitus with hypoglycemia. Essential hypertension. Pure hypercholesterolemia. D.65. Type 2 diabetes mellitus with hypoglycemia. Essential hypertension. 0.5. Hyperlipidemia unspecified. Answer A. 0.9. Type 2 diabetes mellitus unspecified. Essential hypertension. 0.5. Hyperlipidemia unspecified. Explanation: type 2 diabetes mellitus is coded as E.9 because it is unspecified in terms of complications or additional symptoms. Essential hypertension is coded as it, and hyperlipidemia is coded as E.5, which is used when the specific type of lipid abnormality is documented. Option B is incorrect because hypertensive heart disease row 0.9 is not indicated in the diagnosis. Option C is incorrect because E.65 type 2 diabetes with hypoglycemia would only be used if the patient had documented hypoglycemia as a complication of the diabetes. Option D is incorrect because the patient has hyperlipidemia, not hypercholesterolemia, which would be coded as E.0. Question 23. A 70-year-old male patient presents to the emergency department after experiencing sudden left-sided weakness and slurred speech. The physician diagnoses the patient with an ischemic stroke. The patient also has a history of hypertension and hyperlipidemia. How should these conditions be coded? 0.9. Cerebral infarction unspecified. Essential hypertension. 0.5. Hyperlipidemia unspecified. B. 0.50. Cerebral infarction due to unspecified thrombosis of cerebral arteries. Essential hypertension. 0.5. Hyperlipidemia unspecified. C. Stroke not specified as hemorrhage or infarction. Essential hypertension. 0.5. Hyperlipidemia unspecified. D. 0.9. Cerebral infarction unspecified. 0.9. Hypertensive heart disease without heart failure. 0.5. Hyperlipidemia unspecified. Answer A. 0.9. Cerebral infarction unspecified. Essential hypertension. 0.5. Hyperlipidemia unspecified. Explanation: the ischemic stroke is coded as 0.9, which refers to cerebral infarction unspecified as the exact cause. G. Thrombosis or embolism is not specified. The patient's hypertension is coded as E and hyperlipidemia is coded as E.5. Option B is incorrect because OINT50 is specific to infarctions caused by thrombosis of the cerebral arteries, which is not specified in this case. Option C is incorrect because it applies when the type of stroke, hemorrhagic or ischemic, is unspecified, but the physician has already specified the ischemic stroke. Option D is incorrect because OINT9 is used for hypertensive heart disease, not for hypertension without heart disease. Question 24. A 29-year-old male patient with a history of asthma presents with severe wheezing and shortness of breath. The physician diagnoses an acute asthma exacerbation. The patient also has allergic rhinitis. How should these conditions be coded? AJ.901. Asthma unspecified with acute exacerbation J.9. Allergic rhinitis unspecified BJ.909. Asthma unspecified with acute exacerbation J.0. Allergic rhinitis due to pollen CJ.909. Asthma unspecified with acute exacerbation J.9. Allergic rhinitis unspecified DJ.901. Asthma unspecified with acute exacerbation J.0. Allergic rhinitis due to pollen. Answer CJ.909. Asthma unspecified with acute exacerbation J.9. Allergic rhinitis unspecified. Explanation: the acute asthma exacerbation is coded as J.909 asthma unspecified with acute exacerbation, and the patient's allergic rhinitis is coded as J.9 since the specific type of allergic rhinitis is not specified. Option A is incorrect because J.901 refers to asthma with unspecified complications, not exacerbation. Option B is incorrect because J.0 is specific to allergic rhinitis due to pollen, which is not specified in this case. Option D is incorrect because J.901 is used for asthma with unspecified complications, not exacerbation. Question 25. A 35-year-old female patient presents with joint pain and swelling in her hands and knees. The physician diagnoses her with systemic lupus erythematosus, SLE. The patient also has a history of hypertension. How should these conditions be coded? AM.9. Systemic lupus erythematosus, unspecified essential hypertension. B. MM.9. Systemic lupus erythematosus, unspecified OINT9. Hypertensive heart disease without heart failure. C. MM.0. Systemic lupus erythematosus with renal involvement, essential hypertension, DM.9, systemic lupus erythematosus, unspecified, hypertensive heart without heart failure. Answer AM.9, systemic lupus erythematosus, unspecified, with essential hypertension. Explanation: systemic lupus erythematosus, SLE, is coded as M.9 when it is unspecified. The patient's hypertension is coded as it, which applies to essential hypertension without additional complications or associated heart disease. Option B is incorrect because hypertensive heart disease OINT9 is not documented. Option C is incorrect because the patient has no documented renal involvement, which would require a more specific code. Option D is incorrect for the same reason as option B, since hypertensive heart disease is not documented. Question 26. A 50-year-old female patient with a long-standing history of osteoarthritis presents with pain and stiffness in both knees. The physician diagnoses her with bilateral osteoarthritis of the knees. How should this condition be coded? AM.9. Osteoarthritis of knee unspecified. M.9. Osteoarthritis unspecified. B. M.0. Osteoarthritis of knee bilateral. C. MM.10. Osteoarthritis of knee bilateral primary. D. MM.9. Osteoarthritis of knee unspecified. MM.9. Osteoarthritis of hip unspecified. Answer B. MM.0. Osteoarthritis of knee bilateral. Explanation: bilateral osteoarthritis of the knees is specifically coded as M.0, which refers to osteoarthritis of knee bilateral. This code reflects the physician's documentation of osteoarthritis in both knees. Option A is incorrect because the code for osteoarthritis of the knee is more specific than MM.9, which is for unspecified osteoarthritis. Option C is incorrect because M.10 refers to primary osteoarthritis of the knee. which is not specified in the documentation. Option D is incorrect because it includes an unnecessary code for osteoarthritis of the hip, which is not mentioned. Question 27. A 28-year-old male patient presents with chest pain and a cough. He is diagnosed with acute viral upper respiratory infection URI. The physician also documents that the patient has a history of smoking. How should these conditions be coded? AJ.9 acute upper respiratory infection unspecified of F.210 in nicotine dependence cigarettes. BJ.9 acute upper respiratory infection unspecified as 0.0 tobacco use current. CJ.9 acute pharyngitis unspecified FF.210 in nicotine dependence cigarettes. DJ acute nasopharyngitis unspecified Z.0 tobacco use current. Answer AJ.9 acute upper respiratory infection unspecified of 0.210 nicotine dependence cigarettes. Explanation: the acute viral upper respiratory infection URI is diagnosed as unspecified and coded as J.9. The patient's history of smoking is best captured by FF.210 for nicotine dependence cigarettes. Option B is incorrect because a 0.0 tobacco use current is used when the patient is actively using tobacco and nicotine dependences. A more appropriate code in this case, option C, is incorrect because J.9 refers to acute pharyngitis, not URI. Option D is incorrect because J applies to acute nasopharyngitis, which is not the correct diagnosis here. Question 28. A 70-year-old male with a history of benign prostatic hyperplasia (BH) presents with symptoms of urinary frequency and urgency. After a physical examination and review of the patient's history, the physician diagnoses an acute urinary tract infection (UT). How should these conditions be coded? AN.0 urinary tract infection site not specified. N.0 benign prostatic hyperplasia. BN.0 urinary tract infection site not specified. N.1 benign prostatic hyperplasia with lower urinary tract symptoms. C. N.9 cystitis unspecified. N.0 benign prostatic hyperplasia. D.N.9 cystitis unspecified. N.1 benign prostatic hyperplasia with lower urinary tract symptoms. Answer A.M.0 urinary tract infection site not specified. N.0 benign prostatic hyperplasia. Explanation: the acute urinary tract infection UT is best coded as N.0, which refers to a urinary tract infection without specification of the site. The patient's benign prostatic hyperplasia BH is coded as N.0, which specifically refers to a benign prostatic hyperplasia without additional complications or symptoms. Option B is incorrect because N.1 refers to BPH with low urinary tract symptoms, which is not documented in this case. Option C is incorrect because N.9 refers to cystitis bladder infection, which is a different condition than AUT. Option D is incorrect because N.1 includes low urinary tract symptoms that were not mentioned. Question 29. A 45-year-old female patient with a history of asthma presents to the emergency department with an acute exacerbation, including wheezing and difficulty breathing. She is also diagnosed with pneumonia. How should these conditions be coded? AJ.901 asthma unspecified with acute exacerbation. J.9 pneumonia unspecified. BJ.909 asthma unspecified with acute exacerbation. J.9 pneumonia unspecified. CJ.901 asthma unspecified with acute exacerbation. J.9 acute bronchitis unspecified. DJ.909 asthma unspecified with acute exacerbation. J.0 acute bronchitis due to Streptococcus pneumoniae. Answer B. J.909 asthma unspecified with acute exacerbation. J.9 pneumonia unspecified. Explanation: the patient's asthma exacerbation is coded as J.909 asthma unspecified with acute exacerbation, and pneumonia is coded as J.9 pneumonia unspecified. This appropriately captures the acute asthma exacerbation along with the diagnosis of pneumonia, which is not specified as being due to a microorganism. Option A is incorrect because J.901 refers to asthma with unspecified complications, which is not the best fit for an exacerbation. Option C is incorrect because J.9 is a code for acute bronchitis, not pneumonia. Option D is incorrect because J.0 refers to acute bronchitis caused by Streptococcus pneumoniae, not pneumonia. Question 30. A 58-year-old male patient with a history of coronary artery disease presents with chest pain and shortness of breath. The physician suspects unstable angina and orders an electrocardiogram. It confirms the diagnosis of unstable angina. How should this condition be coded? A0.9. Angina pectoris unspecified. B0.0. Unstable angina. C0.9. Acute myocardial infarction unspecified. D0.9. Angina pectoris unspecified. Essential hypertension. Answer: B0.0. Unstable angina. Explanation: unstable angina is specifically coded as RA0. This code applies when the physician diagnoses unstable angina based on the patient's symptoms. It results in clinical examination. Option A is incorrect because RA0.9 refers to angina pectoris unspecified, which would be used if the angina type were not specified. Option C is incorrect because RA0.9 refers to acute myocardial infarction, which is not the diagnosis in this case. Option D is incorrect because hypertension is not relevant unless hypertension is documented as a condition.